Hello, this is Lumen May with May's Message. I'm joined today with my longtime friend and someone who I've spent a lot of hours with the last couple of months as
Yes,
we deal with COVID-19. Dr. Michelle Greer Hall, how are you?
I'm doing great. How are you doing, Commissioner May?
I'm doing well. Dr. Greer Hall, first, let me thank you for your relentless effort in making sure that information is communicated to the citizens of Escambia County. I am grateful, and as I go from my day to day at testing sites and move throughout this district, I'm going to tell you, there are a lot of people who know the Greer name, remember you as a little girl, who are so
Yes.
proud of the doctor that you've become. So thank you and congratulations. I tell you, there's a lot of people who tell me she doesn't remember me, but you tell Dr. Greer Hall, I remember when she was a little girl. So
Oh,
you have a
thank
lot
you.
of,
And some of that comes from the H&O. Grew up there with my family members, and so just knowing a lot of people from what my family created with the H&O restaurant. So I'm very proud of what we were able to do in the community, providing food for those who need it. And my grandfather, if he were still here, he would be out giving food out to those who needed it. So I'm just very proud, and that was something that was instilled in me when I was younger. So yes.
well, you continue the legacy, and as we pay it forward, and we are just the recipients of the great sacrifices that our parents made. I remember my father in Mays Quarter and starting a little church on Blunt Street, and
Hmm.
starting a construction shop, a construction company. I'm the recipient of my dad's goodwill and the prayers of many, and so have you. I mean, your family, the Greer family, whether it was the Grand Hotel, whether it was H&O
Oh,
Cafe. I tell you, Mr. Greer, who's been at the city forever, is still there, and your
hmm.
family just has a great legacy of helping, and you're continuing that legacy and paying it forward with your own children. So thank you so much.
Thank you.
Well, listen, we're going to jump right into some information that we've been
Mhm.
passing along. Escambia County, we had about 665 cases here in Escambia County with about 19 deaths. That's nothing that we all can be thankful for, but what we can be thankful for are the efforts that we put in place to help mitigate it. A lot of the positives that have happened, and as we look to the west and Mobile, and we look further to New Orleans, and even when we go to the east and to the south in Broward and Dade, we see that their numbers are quite higher than ours. And I think it's because of the efforts of community health, your
Mhm.
leadership, Sandra Donaldson leadership, Sandra Smiley, the pastors. The pastors got and stood with me at Brownsville with about 12 pastors who said we're going to do something and we're going to set these sites. And I think as I talked to my colleagues across the state and across the nation, we were one of the first communities to realize how important it was to get in black and brown and poor neighborhoods and make sure that they had testing. And I think we got out ahead of that curve by one going into Brownsville, one of the most historic and one of the poorest neighborhoods in Escambia County. And as we began to learn, we became mobile and put those into remote areas. And I know you'll talk a little bit about that today. So, from a community health Northwest Florida medical perspective, can you kind of give me a status update on COVID-19 and testing?
Well, we're continuing to test with community health. Sacred Heart is continuing to test. Of course, the Department of Health has been here at UWF doing their testing. So we do have testing available here in our county, which is so fortunate for us because there are some places that do not have this testing available. So we are continuing to test as long as we have test supplies available. Community health, we're going to be targeting those neighborhoods that are underserved, making sure we're staying true to our mission of providing good health care for those neighborhoods and making sure they have access to testing as well, because access is so important. We have to put ourselves in those areas so they can get the access to testing that they need. So I think that's something we're going to continue to do as long as we have the supplies available. We're going to continue doing that.
Well, do you want to talk a little bit about the tests, how many tests and the positives? I know cumulatively you've done just a lot of tests in a lot of areas. So you want to kind of talk
Yes.
about that and dispel any myths that may be out there right now?
Yeah, so we have been in various areas. So you have to keep in mind we're testing at our individual locations, at our individual sites. So we are doing testing there. Of course, we have done the drive-through at Brownsville. We've done mobile testing as well. Some of the locations that we've been at is Court, Morris Court, Sanchez Court, Carver Park, Gonzalez Court. Today we are in Century. We've been in Santa Rosa twice. We plan to go to Good Hope AME Church on Friday to do testing. So we have been doing a lot of testing. So there are some numbers we would love to share with everyone, because we're very proud of what we've done. So far, as of today, 1,926 Escambia County residents have been tested, and that's as of today. We don't have the numbers for our Century location counted in there as of yet. And out of those 1,926, 63 have been positive for COVID-19. So that puts our positivity rate at 3%. And that actually coincides with what the state of Florida's positivity rate is as well. Every week we have a teleconference with the Department of Health where we get a chance to see how other counties are doing. And overall, Florida, across the board, everyone's about 3% right now for our positivity rate. So we are actually coinciding with what the other counties in Florida are doing as well with our testing. And we have those numbers available. But we are definitely continuing to test and put ourselves where we can to provide those services for our community. But we do have, when we do go to these locations, though, you have to keep in mind, we're not asking for proof of you live in that neighborhood. So we do not require that. We just ask that you are a Escambia County resident. And so it's community testing. So not only are we going to test those who are in Addis Court, we're going to test those neighborhoods around Addis Court and those neighborhoods around there. Those who need to be tested. We're not going to exclude anyone, but if you are an Escambia County resident, that community testing is available for you. So sometimes what we see that comes to those areas, they're not all from that one location. We know that, and that's okay. We're providing a service, and that's our main goal, is to continue to provide that service and not turn anyone away.
Dr. Greer, thank you for providing that service. Number one, thanks for clarifying that. I was in Cantonment. I mean, I've been in Addis Court, Morris Court, Brownsville, anywhere that community health was testing. I felt it my responsibility to at least come out and show my support to those people who were putting on their PPEs and risking their own health for the safety of our community. And I saw people from all walks of life. I saw red, yellow, black, and white. I saw people that would drive up. It was diverse and it was inclusive.
Yes.
And just not necessarily the residents of a particular housing project, but it was all people. And I think that's the great thing about it, is that you brought it to be central, whether it was on 9th Avenue at Gonzales or whether it was on Cervantes on Addis Court. What you were able to do was bring it to community and put it on bus lines and put it to where people can come. And so people would have the preconceived notion that it was just the people from Morris Court or Addis Court when you were set there. Those are just staging locations, just as Good Hope Church will be, just as Head Start is today in Century. And we're going to move to the Marie Young Center in Wedgwood in the next coming week. We're just trying to work with you to have centralized locations. And, you know, Sacred Heart Hospital, University of West Florida is testing. I think the goal is to not get so focused on where the testing site's located, but to encourage people to get tested so we can move into phase 2 and to move into phase 3, that we meet required testing numbers that the governor has given us. So thank you for doing that. And thank Community Health and your entire staff. But, you know, as a parent, you know, I am very thankful to be home with my son and daughter. They're awesome, 2 kids, and we probably, you know, talk more than we talk, although dad is certainly out there, you know, more than the average person. But I do realize my daughter's a senior in high school, and, you know, this is a plug for all the seniors. Thank you. You've worked hard, whether you're a senior in high school, whether you're a senior at Pensacola State College, at the University of West Florida. You deserve to be recognized for your achievements, your academic achievements. Know that we are with you. We're going to get through this, and there are going to be people like Dr. Greer Hall and Commissioner Lumen May that we're going to make sure that your work does not go unnoticed. I mean, at some point it may be a couple months, but when it's safe to congregate, we're going to do some things. Now we say wait to congregate, and we want people to continue to isolate. But when the time comes, Dr. Greer, I'll be calling on my good medical friends like you to offer support for all of these seniors who are graduating. But with that said, we understand that you are not a behavioral doctor, but you are a pediatrician. And so are there some suggestions to parents, to children who are watching? How do we cope with this COVID-19 stress? And we all are a little stressed. I know I've been a little stressed. I've suffered a little anxiety, but how can we encourage parents and children to deal with this?
That's a very good question. And many people are finding it very difficult to cope. I mean, during this unprecedented pandemic with fear, anxiety, changing the daily routines that we've been so accustomed to, and a general sense of uncertainty about COVID-19. I mean, how long are we going to be doing this? Is it going to affect me? Am I going to catch it? I mean, so there is a lot of fear and anxiety, and I hear it in the voices of my parents when we talk with with the parents of our patients, and we really are trying to do our very best to respond to that. People respond to stressful events in different ways, and there are some things that we do recommend doing to help cope during this time and manage that stress. First of all, we do encourage, and this is when we're talking to our patients, we're talking to the parents, we're talking to the entire family, because we know the entire family is under stress right now. So we do have some things you can do. First, you want to assess your 4 pillars of basic health to ensure that you have the foundation that's needed for emotional regulation. And by those 4 pillars, I'm referring to adequate sleep, because I know some of us are not sleeping well, um,
Absolutely.
myself included. We want to make sure we have a nutritious diet, because what you put in your body is so important. Also, routine physical activity is needed, and that is so important. And then social support. If one of those pillars, if you think about it, if one of those pillars are missing, or if one of them is missing or wobbly, just like a loose leg on a table, you won't have your foundation that you need that's stable. And it's going to be very, very difficult for you to build on that foundation and come up with some coping skills and coping mechanisms and to build ourselves up. So it's very important to make sure you check the 4 pillars of basic health. And with the good sleep, we know how much sleep we're supposed to get. And then of course with nutrition, we know what we're supposed to be eating. So that's pretty self-explanatory. But with physical activity, we want it to be something that you enjoy. It could be yoga, it could be dancing, it could be walking, but some type of physical activity, whatever you enjoy. With the social support, we keep talking about practice social distancing, but that does not mean social isolation. We want you to stay in contact with your friends and your family through social media, FaceTime, Zoom, whatever you can, but stay in contact. So that social support is so key to making sure you have the 4 pillars for basic health. And of course, some of the other things you can do: set some goals for yourself, set some priorities. What's important right now? Because what was important 6 months ago to me is not important anymore. I'm like, you know what?
Absolutely.
I am now prioritizing what's really important on a day-to-day basis. So set some priorities for what's important to you and your family right now. What do you all want to see accomplished? And set those goals. Make some time to unwind and do what makes you happy. Find your happy place. I ask my patients, where's your happy place? What makes you so happy? And so when they're upset, they're feeling anxious, they go to your happy place. Not physically, but in your mind. Go to what makes you feel happy. We have some people doing virtual happy hours. Actually, my best friend is inviting me to one coming up for her birthday. She's in Chicago, but we're going to have a virtual happy hour. No alcohol involved. At least I don't think there's going to be an alcohol involved, but the virtual happy hour where you talk about everything else but COVID, things that make you happy. But COVID should not come up. The virus, Rona, that should not come up during your virtual happy hour with your friends and your family. And that's something you can do on a daily basis. Have a happy hour with your family, your friends, virtually or in person if they're at home with you, where you can enjoy yourselves. And for my daughter, she's having virtual play dates with her friends from class because she misses them so much. So we've been setting up some virtual play dates. So that's something I encourage my parents to do. Set up a virtual play date with some of your daughters or your son's classmates from school, because they will love that simple time that they get to see their friends. I mean, you would think they haven't seen each other in years, right? But we really recommend them doing that. Take a break from the news. I don't know, some of these parents, I know myself, sometimes I'm glued to the TV because I'm like,
Absolutely.
what's happening? And I'm like, I need to turn it off, but then I go back to it. Turn it off. Sometimes we just need to take a break from the news because if you keep watching it can get you more anxious if you continue to watch it sometimes. So just take a break from it. Turn on something else. And then sometimes taking a break from social media. Sometimes on social media, that can make you anxious. Some of the things are out there. You can be like, oh my God, so take a break sometimes from these things and then focus on what you can control. The things we can't control are right now, there's a pandemic. we're doing what we can to control it, but focus on what can I do to control this and make this better. Do some deep breathing exercises, some meditation, some mindfulness activities as well. Start a new hobby. We have some patients, and I'm like, hey, start doing something you've never done before. We have a lot of people who are sewing masks now. They probably never did any type of sewing in the past, but they're sewing masks as a business. So do a new hobby and focus on gratitude. Take time to reflect and be thankful for the little things that you do have. Focus on the glass is half full, and not half empty. And then focus on your efforts to help other people. I have some of my parents who are doing volunteer work, doing things, and that definitely can help cultivate better emotional health when you do have a spirit of altruism and you are willing to help others. So definitely that is something we recommend doing. Bond with your family right now. This is a great time to bond with your family members and spend more time with your children. I've been riding the bike with Lauren daily. So we've been doing some things that we didn't get a chance to do before. And of course, there's always counseling for those who are really having a difficult time. There's always counseling. And I know most places now have some type of telehealth available, but there's teletherapy available. So if you feel like, I just need to talk to somebody and these things aren't working for me, reach out and get someone to talk to. That is available, and there's no shame to saying, you know what, I'm feeling anxious right now. I need to talk to a professional, and there's no shame in that. And trust me, if you do that, you will do better. And because this is not a sprint, this is, a marathon. We need to be prepared for whatever, is coming. So you have to be prepared mentally, physically, and emotionally. So we have to cope with this. And I hope, these suggestions will help those who are viewing cope with this pandemic.
Thanks. You really led into my final question. How do you suggest or recommend that we begin to integrate back into society? I know that we're still practicing social distancing and physical distancing and wait to congregate. And I believe that that's very important. We're only in phase one, going into phase two. But as we look for July and August, how should parents start preparing, our families or our citizens start preparing to integrate back into society?
That's a very good question because we're going to integrate. We need to continue to move forward, and I think there are some things that citizens can do as we open up, and that we can all do to help us move forward. We want to make sure that you're COVID smart. I tell everybody, be COVID smart, and by being COVID smart, get your data from a reliable source. That is so important. The CDC, the Department of Health, make sure whatever you're doing and whatever you're reading is from a reliable source. Know that the threat is not gone. Just because we're opening up things, you have to realize the threat's not gone.
Absolutely.
It's still out there. It's out there just as much as it was, 2 months ago when everything was, complete lockdown. So the virus is not gone. You have to know that the threat is still there. Know your risk as well. You need to know, am I at risk for the complications? Because if you don't know you're at high risk and you're not taking the necessary precautions, I'm afraid you could succumb to this virus. So you have to know, am I at high risk? And that's something we encourage everyone to talk to your healthcare provider about, to see if you are considered high risk for complications and if you are vulnerable, and know if your parents or your aunts know if they're high risk, and continue to spread whatever knowledge and education you have to them, because they may not be able to get to that reliable source like you are. So share the data, share the information you have with others. Don't hold it just for yourself, and see and make sure you communicate that to everyone you know. Know how COVID-19 can spread in the community. There's an excellent video that the CDC put out recently showing how one person in Chicago spread COVID-19 to 16 other people, 3 of which who died.
Oh,
By
man.
attending a funeral, a birthday party. It was like went from one person to the next person to the next person. You have to know this virus will spread if we don't take the necessary precautions. It will, and it's going to spread in those places where we gather, churches, parties, get-togethers. So it's just important to know how the virus spreads. I encourage you, if you haven't looked at the video from the CDC on how one person infected 16 people, It's pretty impactful. So if you can read or view that video, I encourage you to do that. And you have to know how COVID-19 can present as well. It's not just a respiratory virus anymore. For those who think, oh, it's just a cold, it's just a cough. No, it's important to know this virus causes inflammation of the lining of the blood vessels, leading to blood clots, strokes, and overactive immune system that can attack your own body, heart disease, heart attacks, lung disease, kidney failures. This is not just a respiratory illness anymore. Yes, we do see typically the cold, the cough, the fever, the body aches, but we also see patients who are having headaches, sore throats. They all of a sudden they can't smell, they can't taste. They're having diarrhea, they're having vomiting, they're having pink eye, they're having skin findings that 2 months ago we were not associating with COVID-19. So you have to know the signs and the symptoms and know, you know what, I may have this virus. So it's important to also be COVID smart. And that's how you can be COVID smart. And you've already mentioned how to be COVID safe. Wash your hands and keep them clean. Keep them clean, wash them for 20 seconds or use hand sanitizer after you touch surfaces. That is so important. Stay home, avoid those crowds of more than 10 people. Wear a mask. We are encouraging everyone to wear a mask when you go out into public. There you go. All right, there you go. All right, good job. So wear your mask when you go out, even if you're running to the store, wherever you're going, wear a mask. Just because everybody else is not wearing one, they need to be wearing one too. So don't go with what, okay, no one else is wearing one, I don't want to put one on, or I don't think I need to put one on. No, everyone should still be wearing a mask when you're out in public. It's highly recommended, and it's actually your social responsibility to do that, because you do not know if you're that asymptomatic person, like that one person in Chicago who was, who had some mild symptoms, didn't think it was COVID. You do not know if you have it 2 to 14 days after you've been exposed. So continue to wear your mask as well when you're in public. And it's a sign of respect as well. Also, continue your social distancing. Don't touch your mouth, your eyes, your nose. Make sure you clean those hands and don't touch anything. So those are some things you can do to be COVID smart and also to be COVID safe that I recommend.
Thank you, Doc. Thank you so much, Dr. Curry. You've just made some good points, and thank you for sharing that. And I cannot stress more than you've already done that. If you have a pre-existing condition, if you previously had a stroke, a heart attack, if you suffer with diabetes, high blood pressure, high cholesterol, even if you have bad sinuses, I mean, you have a pre-existing that makes you more vulnerable. And if you're over the age of 65, and so please, to all of our friends and family that, you're over the age of 65, we want you around for many more years. If you have a pre-existing condition, please just be safe. You've heard it from our medical providers. Dr. Greer Hall has preached this, I know, for the last 2 months with me, that, we're not out the woods. We may be at the edge of the woods. And we've been deep in the woods. We've been in the middle of the woods, but we're not out of the woods yet. So please be safe. And Dr. Greer Hall, again, thank you for being here on May's Message. It has been a partnership to be able to work so closely with someone that I grew up with. And many of our counterparts left to go to larger cities and probably more profitable situations. But you and I decided to stay home and try to make our community a better place. And it's an honor and a privilege to be on your team. And this COVID-19 has brought us closer together in our to this community. And so, two little people from the stomping ground in H&O and a little boy from Morris Court, we get the opportunity to help our community in a grand way. And I'm humbled and thankful for being able to do that. And, I know you are like me. We're very thankful for the prayers and the support that we've gotten for those who came before us. And so, we can't pay it back to those who gave us, but we're going to pay it forward and trying to educate, trying to create better opportunities for young people, for old people, and for all people. So again, thank you for joining me on May's Message. Is there a closing word that you'd have for the people?
I just want to encourage everyone to stay positive, stay encouraged. There is a light at the end of the tunnel. Stay smart, stay COVID safe, and also, stay COVID stress-free and find your happy place. Thank you so much, Commissioner May.
I like what you said. We got to all find our happy place, right?
Yes.
All right, now I got it, and that's been few and far between. But we are certainly finding that the glasses not always have empty, but sometimes it's half full, and we can see the good things that are happening in our community. So hashtag wait, don't congregate. And to our young people, again, we mentioned it earlier. I want to salute our first responders. I want to salute those who have went to work day in and day out at community health, doing testing in the heat, in the sun, in adverse conditions. They're doing that. But more importantly, to my seniors who are graduating high school, know that there are people in this community that love you dearly, that support you. We're going to have the next Dr. Greer Hall, who's going to be a pediatrician. We're going to have the next Lumen May, who's going to be the county commissioner. You are there, and know that in this office and in Dr. Greer's office, we share this spirit of mentorship, and that if you need us, you call us. You call me 595-4930. I'll put you in contact with Dr. Greer Hall if you just want help, and know that there's a listening ear. So Dr. Greer Hall, thank you for being here on May's Message.
Thank you.
Thank each of you. Thank you for listening. I'm Lumen May, County Commissioner for District 3. If no one else tells you today that they love you, Commissioner Lumen May loves each of you. Thank you, and God bless.